Honorable Ministers, ED Fore and Honorable Kevin Rudd, SWA's high-level chair, partners and friends of SWA, good morning, good afternoon, good evening to all of you, and thank you so much for being with us today. We are very pleased to have you with us, especially our esteemed guests. This webinar, as the one that we had two weeks ago, also organized with UNICEF and with WHO, focuses on the ongoing and rapidly evolving COVID-19 pandemic and how we can most effectively engage to transform the biggest crisis that we are facing in our lifetime into a chance to do business unusual. To finally realize our vision of a world where everyone has access to water, to sanitation and hygiene. This crisis has highlighted the importance of water, sanitation and hygiene, and this message has to be embraced by our heads of state, our presidents, our prime ministers and our finance ministers. SWA, together with its partners, has prepared a leader statement. I've talked already about it bilaterally with some of you, to be signed by heads of state and government and of UN agencies as well as other leaders. And we call on you to reach out to the leaders of your countries and organizations and encourage them to sign this call to action. If you are leading the organization, you can sign it yourself, of course. This webinar will highlight the urgency with which we must now engage politically with decision makers to secure resources for water, sanitation and hygiene now and in the future. UNICEF's ED Fore and the Honorable Kevin Rudd will introduce this webinar, and you will then hear from me again as I introduce the various speakers. A few housekeeping notes. This webinar is 2 hours long. We will have time for discussion throughout the webinar, but you are welcome to leave comments or questions in the chat box, and we will come back to them. To our esteemed speakers, may I request that you remain within the allotted speaking time. We have interpretation available in Spanish, English and French, and in order for the interpreters to accurately convey your messages, we ask you to speak slowly, which is something I should practice. I also ask you to please select the language button that corresponds to the language you are speaking in. Okay, now it is my great pleasure to introduce the Executive Director of UNICEF, Ms. Henrietta Fore. Edie Fore, you have the floor. Edie Fore, you have the floor.
Thank you very much. And can you hear me? Good. So good morning, good afternoon, good evening, everyone. It is nice to see a few of you who I've seen on the screen. I hope that you, your families, and your teams are both healthy and well. It's an extraordinary time in our world, but it's a very important time for us in water and sanitation. Water and sanitation are really at the heart of this, at the center of this crisis. So it must be at the center of our response. Hand washing and hygiene have never been more important. But for millions of children around the world, both water and hygiene facilities remain out of reach. Children that are living in remote areas, that are living in crowded spaces, and where water is untreated or it is polluted. Or those who lack access because they're homeless, they're living in a slum or on the street. Our latest data indicates that only 3 out of 5 people worldwide have basic hand washing facilities. That's about 3 billion people with no ready access to a place to wash their hands. Yet we know that hand washing with soap is one of the cheapest, most effective things that you can do to protect yourself and others against coronavirus, as well as many other infectious diseases, which is why WASH is at the center of UNICEF's response. We're ramping up access to proper hand washing supplies and hygiene kits to families, communities, schools, and clinics. We're scaling up our community engagement and communications efforts to provide children, families, communities with information and tools to promote simple and effective health interventions like hand washing and social distancing. So if you all have not yet made one of these hand washing videos, It is really helpful, and it is good to tag to several other members of your country to make so that people know how to wash their hands. WASH is a central part of this response, recovery, and funding priorities, including our humanitarian action for children appeal. But we also know that we must do much more. Too many families are going without these basic services, which require investments from families to purchase soap and sanitizer, not to mention available water supplies required for basic hygiene. WHO recently issued new recommendations, including universal access to public hand washing stations, their obligatory use before entering or leaving any public or private building, as well as improved access to hygiene service in all healthcare facilities. Translating these recommendations into reality while also safeguarding family incomes and ensuring a steady flow of sanitation and hygiene products will require significant investment and support. Your governments have a role to play in social protection programs to support family incomes, in keeping borders open for trade and transportation of wash supplies, and through your generous contributions to the global fight against COVID-19. But our work must include greater private sector involvement. I've been speaking to CEOs of leading multinational corporations. They're stepping up with offers of funding and contributions in kind, and they can also play a role in strengthening and speeding up supply chains for critical items like soap and sanitizer. We're very encouraged by this support, and UNICEF and our partners are bringing these important stakeholders together in a shared platform of joint action. We're also engaged with national and local companies who have always been a critical part of the wash market, even more so now as transport and supply chains are challenged. In face of a challenging pandemic and the economic consequences it brings, I am nonetheless encouraged by the leadership and the cooperation that is emerging on this issue. So finally, in conclusion, I look forward to this discussion today and hearing your ideas on how we can all contribute to ending the spread of the virus and keeping children and their families safe and healthy in the years to come. Thank you very much.
Fore, thank you so much for your inspiring and encouraging words. Also, thank you so much for the challenge that you left here for all the ministers present to do the hand washing challenge and show everyone in their respective countries how we should protect ourselves from the virus, but also from other illnesses. Thank you so much for your time. Now I would like to move to the next speaker, to whom we at SWA are very grateful for his support and leadership as our high-level chair. As you all know, the Honourable Kevin Rudd is a former Prime Minister of Australia. It is very late for him in Brisbane, Australia. So, Kevin, I will let you take the floor with further ado.
Well, thank you very much, Catarina. And thank you for the work you are doing with the Secretariat of Sanitation and Water for All. And thank you also, Henrietta, the Executive Director of UNICEF, for the continued strong role which UNICEF plays in the world, including during this current crisis. And I extend my greetings to all ministers and their representatives who are joining us in this webinar, ministers for water, ministers for sanitation, as well as ministers for development assistance from around the world. We've all heard a lot about COVID-19 over recent months. We've all seen a lot about COVID-19 in recent months. We've seen deaths on a large scale. We've seen hospitalizations on a large scale. We have seen infection rates on a large scale. And regrettably, this crisis is not over. It's not even the end of the beginning of this crisis, to paraphrase Churchill. It is a long, long journey which lies ahead of us. Of course, when we look carefully at the spread of the virus around the world, what began in China has now gone to many other parts of the world. Back in February, I wrote that what we have seen in China in January and February, we'll see in the developed world in March and April. And I fear that we are going to see a further extension of this virus in May and June with greater and greater levels of intensity across the developing world. This therefore represents by its very definition a global challenge and a global threat to peace and security, and certainly a global threat to development. We at Sanitation Water for All have proudly represented the WASH sector in all of its dimensions, both governmental participation, NGO participation, international organisation participation, as well as the private sector. In fact, our mission statement has been to bring all these groups together in a common cause around Sustainable Development Goal number 6. Now, however, with this fundamental crisis to us all in terms of COVID-19, it brings into absolute stark relief the central importance of WASH. As Henrietta has just said before, wash your hands has now become the universal catch cry of the public health response to the COVID-19 crisis across the world. And we collectively represent the WASH sector. And therefore, these two worlds now come together. We have known even before this crisis that an effective WASH, that is, availability of clean water and effective sanitation, is the single best predictor in terms of the rest of the Sustainable Development Goals, including longevity. And we also now know from the repeated presentations on this virus itself that effective WASH is again the single best preventative for the transmission of this lethal virus around the world. So therefore, our sector has become front and centre, both the symbol and the substance of the challenge which lies before all countries in the present period. So the critical question then for all of us is, what do we then do about it? We've had, of course, a plan of action for sanitation and water for all governments for some time now. But I would suggest two clear courses of action which we should embrace. One is for all donor countries around the world to sustain their efforts in terms of ODA delivery across the world. This is not the time for governments to cut back on ODA. And therefore, what is required through the United Nations, through the G7 and through the G20 is an absolute universal political resolve to sustain ODA levels. Second, through the international institutions, led proudly by the bank, the World Bank, and under the great leadership of Kristalina Georgieva, that we also, through the World Bank and through the regional development banks, sustain the investment effort in water and sanitation around the world in partnership with private finance. Let me add a third resolve, and that's for those ministers who are participating in our webinar as well. Ministers in the front line, ministers for water and sanitation in countries around the world. It is critical within your governments, despite all the pressures that are going to be brought to bear on your cabinets, for you to hold the line in sustaining national government budgetary effort and investment in water and sanitation, because it is fundamental not just to the immediate resolution of the COVID-19 crisis, but also the path to genuine long-term sustainable development. So I can encourage you all to continue doing this most critical work, not just in responding through WASH to the COVID-19 crisis, but in your further and continued recognition of WASH as fundamental to the entire SDG enterprise for us all. Thank you, Catarina.
Thank you so much, Kevin, for your message, and also for the three courses of action that you outlined here. I think it's a very, we will tweet about it. You are not the only one tweeting in the world. Well, even though you tweet a lot, you take lots of space, but we will tweet about it. And we think that your 3 courses of action are a good inspiration for the discussion that we are having now here in the next 2 hours. And also, as all the participants go home, switch off from the webinar and start going back and go back to their work. So before we hear from our presenters, I would like to tell you about why SWA is holding this webinar. As both Edie Fore and the Honorable Kevin Rudd have said, COVID threatens the gains that we have all made in the last few decades in the area of water, sanitation and hygiene, and even can put at risk the plans that we have for the future to reach SDG 6 in 2030. So we have to work to ensure that what we do now responds to the needs dictated by the COVID-19 emergency, but also that what we do is sustainable and can put us all on track to achieve the SDGs. To this end, we must accelerate our work towards building water, sanitation and hygiene systems that are resilient, that are sustainable, in order to protect people's health, support national health systems and have vibrant economies. Hand washing, as our Honourable Chair has said, has made headlines everywhere as a solution to stop the spread of the virus. This is true, but hand washing cannot happen without the strong water and sanitation systems that we have always advocated for, that you have always advocated for. We need to recognize this now to combat these and future threats, including climate change. Further, we must work in partnership with all stakeholders in a coordinated and collaborative manner at national and global levels, as we are doing here today in this webinar. Each actor, whether public, private, a donor or a civil society member, has something to offer to overcome COVID-19. Sanitation and Water for All is the key platform for national, for regional, but also for international cooperation at all these levels, and advocacy, as well as for exchange of experiences. We will come out of this stronger. We will learn from this experience and must make the lessons we are learning count. We cannot simply go back to doing business as usual. We must develop a clear vision of what we need to accomplish and fight for it even harder than before. We need to keep up the political momentum. The COVID-19 pandemic will change many things in the world. We need to ensure that the change when it comes to water, sanitation and hygiene is a positive one, as Kevin Rudd was saying. And you as ministers have obviously a key role to play when you are in discussions within your cabinet. One that leads, I'm talking about the positive change. So a type of change that leads to more political prioritization, finance for the sector, clear commitments and accountability between governments and key stakeholders, and a bigger focus on those who are the furthest behind. The COVID-19 is a global crisis which demands determination, commitment and courage from all of us. As we proceed in our discussions, we will hear from our first panel of ministers, namely the ministers from Nigeria, from Peru, from the UK, from Burkina Faso and Bangladesh. We shared with the ministers in advance the 2 questions I might ask them to respond to. Following panel 1, we will have interventions from the World Bank, the InterAmerican Development Bank, the African Development Bank and Unilever. Then we will have a time for some questions and answers and some quick interventions. And as I mentioned earlier, please share any questions you might have in the chat. Then, as you can see on the screen, our second ministerial panel comprises Ghana, Colombia, Madagascar, Liberia, Maldives, and Eswatini. Ministers will respond again to one of the 2 questions we asked of them, and we will end with a final Q&A session with some interventions from other partners and ministers. I hope that we are all good. Are we good? I hope so. So let's start the first ministerial discussion. The two questions that ministers were asked were, number one, what initiatives are your government taking to ensure continuity and expansion of water, sanitation and hygiene services during this pandemic? How are you ensuring that WASH remains a key priority in this landscape of so many competing demands? Number two, second question that we asked, what financing mechanisms or approaches are you putting in place to ensure services are available to all, especially the poor and the most vulnerable? We ask each one of the honorable ministers to take maximum of 5 minutes because we were a bit victims of our success and more ministers have joined the call, the webinar, and they would also like to have an opportunity to talk at the end. So let me start with you, Honorable Minister Suleiman Adamu from Nigeria. I will turn to you first. You are the Minister of Water Resources, I already said, in Nigeria. Could you please tell us what initiatives your government is taking to ensure continuity and expansion of services in the context of the pandemic? As I told you, please try to keep your intervention to 5 minutes. Thank you so much.
Thank you, Catarina. Good day to all participants. Thank you for inviting me to this webinar. First of all, we've categorized our interventions into two. Obviously, important one is the current situation. We do the emergency period where we have the pandemic and most of our major cities are on lockdown. And secondly, going forward. We are, first of all, targeting our isolation centers to understand what their WASH needs are and support them as much as we can. Also looking at vulnerable areas without hand washing facilities, with access to running water supply. We're coming up with a plan, especially, we have internally displaced persons, camps all around us because of the insurgency in the northeastern parts of the country. Then, of course, we're targeting public places also to provide water and sanitation facilities. But most of all, we're dealing with the advocacy. We're doing a lot of advocacy in collaboration with UNICEF and the Water Supply and Sanitation Collaborative Council. We've designed some jingles. They're already on air, admonishing people to do the needful, washing their hands with soaps, using sanitizers and social distancing. Then, of course, we're looking at, because this is a federal state, Nigeria is a federal country with 36 states, the federal government is not directly dealing with the provision of water supply and sanitation. This is a prerogative of the states, but we are supporting the states. We're looking at state water agencies to see what support we can provide for them. And our main focus is really looking at water quality issues, laboratory equipment and things like that. Also maybe chemicals and reagents for them to be able to do tests better so that we can have improved water quality. And then we're leveraging on the private sector. We have in Nigeria what we call, since we started the campaign against open defecation, we have the OPS, that's Organized Private Sector WASH Forum. And we're working with them right now. We've been introduced these hands-free hand washing facilities, and we're beginning to get a quite big order for them and to supply to vulnerable places. So that's one thing that we're doing with the private sector. And most importantly, we're in the process of establishing the WASH Sector COVID-19 National Response Committee that will be chaired by the Minister of Water Resources at the federal level, and all the 36 commissioners responsible for water will be on the team, and will be through that committee will be able to understand and identify the key specific needs of each state and see how we can support them. And we'll also have the standard, what we call the National Task Group on Sanitation in the country has been existing for a long time. So also incorporating them into this plan to ensure that we come up with also additional strategies to use. And we're also involved in a lot of monitoring to ensure that what we put in place has actually been put to effective use and that people are paying more attention to sanitation. Of course, the government has just launched a 500 billion naira stimulus package for the country in response to COVID-19 pandemic, and water, sanitation, and hygiene have been identified as a major component to be considered. I mean, to be funded under this stimulus package. And right now, I'm working with my team on specific strategies that we'll share with the Ministry of Finance, Budget and National Planning, so that we can get maximum effect, arising from this pandemic. And of course, we'll continue to work on our efforts. Nigeria has already been on under watch emergency since November 2018, when President Buhari launched the state of emergency on water, sanitation, and hygiene. So there's been a lot of work. We have lots of programs going on, like the Partners for Expanding Water Supply, Sanitation, and Hygiene, and the Clean Nigeria, Making Nigeria ODF by 2025 campaign, and the National Action Plan that was also launched in 2018. So we're going to continue to work on those. And we're sending a key message to the country, just like Mr. Kevin Roth said. We're using this pandemic. We're trying to make the country and our finance minister and everybody aware of the connection between this pandemic and lack of proper hygiene. So going forward, we're going to leverage on that to ensure that our government commits more resources, much more than it's been doing now, to ensure that WASH is given the priority that it deserves. Thank you.
Thank you so much, Minister Adamu, for your intervention, but also for the concrete examples of the way in which your country is approaching this crisis. And it's also particularly interesting to hear from a country with the characteristics of Nigeria as a federal country, which has, of course, special challenges, and the way that you are addressing the situation can also be of interest to other countries that are present in the webinar who have the same characteristics as yours. Es ahora mi honor pasar la palabra a Su Excelencia, el viceministro de Perú de Construcción y Saneamiento del Ministerio de Vivienda, Construcción y Saneamiento, el señor Julio Jarima. Le voy a preguntar, Excelencia, voy a hacerle, Excelencia, las mismas preguntas que hice antes, quiere decir cuáles son las iniciativas que el Gobierno de Perú ha tomado para asegurar la continuidad, pero también la expansión de los servicios del agua durante la pandemia y cómo garantizar, cómo asegurarse que agua, saneamiento y higiene son una prioridad política y financiera en el marco del Gobierno de Perú. Su Excelencia, me parece que usted todavía está en silencio. Puede clicar ahí el micrófono. Está perfecto. Gracias.
Sí, Catarina, a ver, el Perú es un país que tiene pues más de 33 millones de habitantes. Tenemos un índice en el cual pues hay más de 3 millones de personas que no tienen absolutamente ninguna conexión de agua continua. Lo que tenemos es que la priorización que se ha dado desde el gobierno y desde el Estado es primordial. O sea, desde el punto de que una de las principales iniciativas del gobierno es todo el tema.
Initiatives that we have in the government, specifically for hand washing and hygiene and any matters, are taken into consideration. Accordingly, as part of the these guidelines to continue with some initial actions, core actions that allow us to have these water and sanitation services as of this month of April. But we know that, well, now we are waiving the payment for our users, for the population, specifically those sectors that are more vulnerable and we have more, let's say, resources and more investments made towards the effort. So we will continue always supplying this water by these sanitation and water companies specifically. So this is exactly what we are trying to do. This is what the state is trying to do. We have 50 companies that are now being affected in financial terms so that no water utility collection is made from these users. So these are one of our key priorities, and also providing service continuity so that everyone has continuous access to these water services. That's on the one hand. On the other hand, we also need to continue working with the housing and sanitation sector. We know that we also have companies that need to be enabled in terms of providing them with maintenance and financial investment so that these companies do not collapse. This is an important matter. Why? Because we have identified that we have certain flaws in the collection services, specifically of water and sanitation, that are causing issues in these companies providing these utilities. So since these companies have got less income, while we as a government, we are providing everything that is needed. We're enabling these companies so that these services are just really provided to the population. So we are providing these companies with funds as backup funds so that they can use them if needed, so that they can continue with their maintenance and providing the services to the population, just to ensure that this water supply would not be somehow interrupted, that this service provision is timely and in due form. So as part of this effort that we have undertaken for us to continue expanding these services, well, we have a large number of individuals who are also part of this vulnerable group who do not usually have access to water. For that reason, we're trying to provide them with a system for them to be able to get this water supply. We are providing them with over 12,000 cubic meters per day to this population that has limited funds, free of charge. Absolutely. The government is doing this not only through a set of standards, but also by enabling these companies providing these services. We're also providing this support to our vulnerable population. So we also have standards and mechanisms in place that will continue to be supporting these water and sanitation services, and for us to be able to allow a wider use. Thank you so much. Thank you so much, Your Excellency Julio Kosaka. Thank you so much for your intervention, for your support. Now I will get into English.
And I'll move now to you, Undersecretary Morton. Thank you so much for joining us. Is the sound working in English? Well, I'm talking in English. Among your many responsibilities, one of them is water and sanitation, as well as global health security. Could you tell us what the UK government is doing to support WASH in countries' COVID-19 response, and what can ministers do to ensure they access those resources for WASH? Also, what should sector ministers be saying to their finance counterparts and other decision makers to ensure resources for WASH are made available and prioritized in the context of severely constrained economy? Thank you.
Thank you, Catarina. And first of all, may I thank SWA for organising this really important session today. And it just shows the global reach that this webinar has this afternoon. I think it's important to note that from the very start of coronavirus, that hygiene, but in particular hand washing, has been a really vital part of the response. In the UK, one of our real concerns centres around the impact that the coronavirus will have on countries with lower capacity health systems and where access to water and sanitation is limited. And I think it's really important that the response that we make needs to be tailored to specific contexts. So to give you an example, where physical distancing is harder, we know that water and hygiene interventions are even more important. So just emphasising that need to be specific in our response. Over 3 billion people worldwide do not have the facilities to wash their hands on a regular basis, something that many of us just take for granted. And more resources, particularly from developing country government budgets, are going to be needed to tackle the challenge that we face. Here in the UK, so far, we've pledged £544 million of UK aid to help respond to the current pandemic. And the UK is the biggest donor to the international response. Our Prime Minister has called on fellow G20 leaders to work together to develop a coronavirus vaccine, a vaccine which will be available to everybody. But before a vaccine is available, I cannot underline enough the importance of preventative measures, and that includes hygiene behaviours, which are absolutely vital. DFID is considering further also the shifts that are going to be needed across our programmes to help support countries through this crisis. But I would like to share with you, Catarina, and others on the webinar this afternoon, one example of UK support. This is where the UK has established a hygiene coalition with Unilever, the London School of Hygiene and Tropical Medicine, and a growing number of international organisations, NGOs and other partners to deliver hand washing campaign at scale. With £50 million of UK aid and an equivalent contribution of supplies, knowledge and expertise from Unilever, the coalition is set to reinforce government-led hygiene communication in over 20 countries in Africa, Asia and the Americas. And I think this is just such a great example of how a private company, a research and learning institution and civil society can collaborate with government to react quickly and in the context of the current pandemic. And I'm sure, like many others, if there is one thing amongst others that coronavirus is showing us, it's that need to collaborate and to cooperate around the world. I appreciate that much can be achieved through improved operation and management of water and sanitation facilities, but these changes will also require additional resources. Development partners such as the Department for International Development, or DFID, can and are adapting our assistance to improve access to water and hygiene based on guidance from the World Health Organization and other authorities. And that's why we're here today. In most countries, including in the UK, the situation will get worse. It will deteriorate before it gets better and before it improves. Let's not forget we're all in this together, and the UK is ready to help the response to the best of our ability.
Thank you so much. Yes, I'm speaking English. And the Secretary Morton, thank you so much for your words and for sharing with us all the things that, all the initiatives that your government is taking in the context of COVID in general, but then in the area of WASH in particular. And it's also our great pleasure to have the CEO of Unilever today with us, and he will take the floor later. And I'm sure that he will also talk about your joint initiative and also the work that Unilever is doing with UNICEF. So at this point, I'll go back to I will continue with the next speaker, and now I will move to French. 1 second.
In order to give the floor to His Excellency Yogodwazo Drago, this is a pleasure for us to have you with us today. His Excellency is the Minister for Water and Hygiene and Sanitation in Burkina Faso, an old friend of our partnership who were together with the Minister from Nigeria. We were together in London in the meeting that had been organized by WaterAid, and I will ask you, sir, what are the mechanisms, the finance mechanisms that you are setting up back home in order to make sure that water, sanitation, and hygiene are available for all, especially for the poorest and the most vulnerable people in the context of this pandemic. You now have the floor, Your Excellency. I cannot see you anymore. Oh, you're here. Oh, I can see you now. Okay. Many thanks, Catarina. Many thanks also to SWA for this initiative, for this webinar, this special webinar, of course, concerning our current continuing concern, which is access to water, sanitation, health, also in a particularly difficult hit zones, especially regarding the work concerned with this pandemic. So in order to mention this very quickly, I will first of all share with you the actions that we are undertaking on national level in order to tackle this pandemic, and I will finish with the finance mechanisms. So first of all, on national scale, the Burkina Faso has set up a national coordination that we have called Chorus, and this Chorus is a government group that regroups different departments such as health and research, because these are important levers in our daily fight and in our vision that we have to take in order to tackle COVID-19. So this is an important fight. And regarding the political decisions, regarding the governance decisions, it was decided that water would be made available for free, whether we're talking about hygiene at home or whether we're talking about water points for the populations that are in needs, who could then come with a 20 liter or 50 liter container or 100 liter container, and they will then be able to get some water for free in Burkina Faso, at least for the first 3 months in April, May, June, and afterwards we will assess the situation again to see what kind of measures will be most relevant in our approach. We have also set up most adequate device to wash our hands. We have raised awareness so much that some young creators, some young engineers and technicians now are manufacturing some materials and some devices in order to provide hand washing facilities, or whether we're talking about masks and so forth, as this is now getting implemented more and more. These measures or also with a contribution of 10 millions of US dollars from the government in terms of financing, with some technical support, with some private sector participation, with the participation of some private companies, and the participation with a lot of goodwill. There is a national mobilization in the country for this concern. If any imported project or manufactured project is exempt of tax at the moment in order to fight this together. So that's one such decision. Now for the populations, we also ask them to respect the attitudes and behaviors that could prevent the spreading of the disease, because we know that, for example, social distancing and so forth is very important. There is a lot of gathering every day, and with people going to the markets and so forth, and this is an important thing, and therefore we have to adapt the daily behavior. We have to adapt the daily behavior with this particular trend. There is also in the water sector, we have accelerated and implemented system where we would provide some sanitation. That's the decision that was undertaken. And once again, we also have the national constraints in terms of containment, in terms of people moving about, whether we're talking about the reduction of promiscuity and all of these actions and behaviors with the national coordination through chorus. This is all being implemented. So we think that with these particular steps, whatever we say, as we stated in London, this will promote in a forced and unavoidable manner, this will promote awareness in sanitation, in washing our hands, because now this is a worldwide situation. I think that we all become stakeholders for SWA, all actors for SWA, for hygiene and sanitation, for us to embrace this so that even after the virus, we do not release these better behaviors. So in terms of funding, as I've stated, the state cannot finance and fund all of this, especially as you know that it has been difficult for us in terms of budget for many years, but the government yet took the decision to redraft the budget for the year 2020 in order to integrate as a priority the budget in terms of financing for this tackling this pandemic. And on that point, once again, there is a kind of national solidarity fund that has been set up in order to gather the relevant contributions. And I can assure you that as of today, this fund is now worth more than $2 million in contributions. And this is the result of some contributions in kind, some monetary contributions, some intellectual contributions and material contributions, and also equipment contributions, and also with the support of our usual partners and even some new partners. And that's the case with UNICEF, who's a donor, and which were associated. These are the kind of actions undertaken, and they are now mobilized the whole of the population, because now, unfortunately, we have to say that Burkina, unfortunately, was one of the first Western African countries to be hit by COVID-19. Many thanks, Catarina. Many thanks, dear Minister, by your words and by your participation with us today. And I will now give the floor
now to Honorable Mr. Islam, who is the head of the ministry, which focuses on local government, rural development and cooperatives in Bangladesh. Your Excellency, could you share with us the financing mechanisms you are putting in place to ensure that services are available to all? Thank you so much.
Yeah, thank you, Catarina. I express my thanks to you to organizing this kinds of a occasion and connectivity with the many countries. The honorable ministers, distinguished and participant. Actually, from the part of Bangladesh, I like to say, since the beginning, we were watching the situation, and under the leadership of our honorable Prime Minister, we have taken some program phase by phase. Firstly, we have tried to scan all this carrier from the entry point of the airport. And then later on, whenever, after finally we have identified at March 8, one person in Bangladesh. So we have taken the serious initiative. Besides that, from the beginning, about the issue, what we have given the emphasize, we were starting to aware the people about the hand wash and hygiene. So all this issue we have started to convey all to all the people even living in the rural area. So besides that, we have then when the thing this is the very is giving the very serious issue in over the world, and we have started to stop the public transportation and the communication stoppage and stay in isolation for most of the people. But in the same time, we have arranged to reach that for the wash purpose, you see. We have arranged to immediately from my ministry, we have given about $4 million to the whole over the Bangladesh to for the soap and hygienic items. And we have started to set up many numbers of the public hand washing center. So beside that, we have given an official order not to disconnect any water supply because of non-payment of their bill. So after that, and I express my heartiest thanks to the UNICEF and World Bank. They have given some financial support. That is, UNICEF given about $0.4 million, and World Bank had given $0.25 million for the purchasing the soap. I think you know, Masmo, that Bangladesh is a number one densely country in terms of the population in the whole of the world. So, and the country was submerged in the poverty level, and immediately we have graduated in the level of the developing country. So despite all this situation, and the Honorable Prime Minister Sheikh Hasina, she has announced $8.5 billion one national program to rescue and support all the people where it is necessary. So for wash and hygienic issue, I like to say Bangladesh have about 99% water coverage. So all those people have a water, and then we are encouraging to wash hand much more. And also we are encouraging the people to use the mask and hand glove and remaining isolated at home. Though the number of the infected people is continuously rising, today it is 2030. People have been already infected and 21% already been died. So, but from the part of Bangladesh government, and we have taken a lot of initiative, and we have engaged all in the rural area, all the local government elected body in the remote area, and we set up some sorts of the management system by which they can address and they can give the support about all the this pandemic issue not to spread much more. So we are trying like this way. And in the same time, actually, it is one of the, I think, requirement, because the huge people, and it is a unusual and indifferent challenge in global context. Bangladesh is a different type. So our development partners, ADB, World Bank, JICA, and they are also spontaneously giving their impression to join with us. And in the same time, we have engaged our civil society and NGOs to work collectively with the government. So this is the actually Bangladesh situation, and one good advantage for us is that under the leadership of our Honorable Prime Minister, all the nation is more or less unified. And so whatever the promulgation, instruction, advice is coming from the government level, people is joining with that, and they are working from their level and giving the effort, assistance for as much as possible to face this crisis situation.
Thank you.
So thank you.
Honorable Minister, thank you so much. Thank you so much for your intervention and participation. And I'm very happy to see Jennifer Sarah back on the screen. I was going to WhatsApp you, Jennifer. And I will now turn back to some of our development partners and also the private sector who are here with us, including the World Bank, the InterAmerican Development Bank, the African Development Bank, and Unilever, as I had said. Jennifer, thanks so much for jointly doing this webinar with us. You are the director of the Global Water Partnership at the World Bank, and we would like you to try to address these two questions in less than 5 minutes. The first one of them being, I hope Jennifer can hear us.
I can hear you.
Oh, good. Could you tell us about the resources the bank is making available to support WASH in the COVID response, and what can ministers do to ensure that they access those resources for WASH? We have been talking a lot about this, you and I. And number two, what should sector ministers be saying to their finance counterparts and other decision makers to ensure that these resources are made available and also prioritized in the context of constrained economies? Thank you, Jennifer.
Okay, thank you, Kata. Hello, everyone, and thank you so much for inviting the World Bank's Global Water Practice to join this very important discussion on the role of water and WASH in the response to COVID-19. I really want to give a special thank you to our host, to SWA, and also to all the ministers for joining us today and all the other development partners from the public and private sector. As many of you know, we were actually supposed to be meeting in person, along with your ministers of finance, in the next 2 weeks at our spring meeting. I'm sorry we're not going to be able to do that this year, but I really want to congratulate Catarina, a huge shout out to Catarina and her team, because you've kept the momentum going, you haven't missed a beat, and you've switched to a very effective virtual communications platform to allow us to continue to share experiences and mobilize the much needed action at the country level. So thank you for that. The World Bank Group has quickly mobilized to provide an emergency response to the pandemic across our country partners in the short term emergency response, but we're also already planning a longer term support and how we can help countries shorten the time to economic and social recovery once this crisis has passed. I'm being very optimistic. As you are aware, the bank prepared in record time a $14 billion package of fast-track financing to help countries prevent and respond to the rapid spread of COVID-19. And the first set of emergency support operations were approved on April 2nd, just last week, and there are many more in the process of being designed and will come online this week. I'll be perfectly honest, because that's a great question you asked, Catarina, what do our sector ministers do? An initial focus of these resources has really been on supporting an emergency response from the health sector. So we've spent the last few weeks really trying to mobilize very quickly and getting the word out that WASH is an integral part of the health sector response, and it needs to be included. And we relied very heavily on our partners at UNICEF, WHO, London School of Hygiene, Tropical Medicine, and other partners who have to make the case, allowing WASH to be included. So we're happy because the case was made, and now we need to respond. And aligned with the partners, we see 3 areas of response, which aligns very well with what the ministers have just said on the call. The first, of course, is an emergency safe WASH facilities in all healthcare facilities. 40% of facilities do not have provisions for hand washing at the point of treatment. So this is a huge priority to keep our patients and healthcare professionals safe and prevent further transmission. The second one is, of course, and it's been mentioned by several of our speakers, including from Burkina Faso and Nigeria, how do we help governments launch and design, launch, improve national scale hand washing behavior, food hygiene, and safe water practices? The campaigns to do that, the designs, bringing in the private sector and the communications for that. But of course, associated with that is we need to make sure there are water and sanitation facilities and hand wash facilities available in soap in all of the communities, and especially if we look at COVID hotspots and urban dense settlements, that's where we really need to think about providing quick community access, expanding the water points and kiosks to prevent crowding as people fetch water. So again, emergency response to provide water and sanitation urgently to everyone and in all public facilities. And the third one is, as mentioned by our minister from Peru, is to really ensure the continuity of service provisions from water sector utilities and other forms of service providers. In the short term, this is incredibly important just to ensure the availability of chemicals, of chlorine, and to make sure there's staffing levels, fuel, electricity. But we also now see, as mentioned by the Minister of Peru, that more and more countries are saying, do not charge for services, do not cut off people who don't pay for services. So how do we make sure that our water utilities are going to have the financial resources to continue to operate? This is hugely important, and we're drawing on the expertise from other associations like Aguas de Portugal, American Waterworks Association, and coming together with other utilities across the world to exchange approaches and materials on how to be managing utilities in the long run. Also noting another very worrisome study that the COVID virus could possibly survive in fecal matter for up to 10 days. So the importance of sanitation and wastewater treatment will be incredibly more important. So the first phase of response does include these provisions. And what it means is that the water sector ministries really need to lobby, I guess, if that's the right word, the ministers of finance and ministers of health to be included. But in addition, we are going through, as we speak, our $30 billion existing portfolio of projects, working very closely with all of our sector ministries to see in existing projects, can we restructure them? Can we provide additional financing so that they can be directed towards an emergency wash response in hotspots? In the longer term, in the next 15 months, there will be a lot of money available, so we hear, up to $160 billion to support not just COVID response measures, but to mitigate the longer term impact. So what I urge now is to take this opportunity as we provide an emergency response to also be setting the foundation for longer term funding, to access longer term funding for the sector. And it could be included as part of a policy support and fiscal stimulus measures that was mentioned by the Honorable Minister Suleiman Adamu just now for Nigeria, to ensure the provision of wash services, but also looking at water for other productive uses. They're going to need agriculture, industry, to ensure job creation and getting cash to communities. Two other points is that we're leveraging our important trust funds, one, the 2030 Water Resources Group, to help use its multi-stakeholder platforms to bring in the private sector and civil society around the public sector support, especially on issues on the supply chains of materials, of wash and hygiene related products, and also their expertise in hand washing. I'm happy to hear that Unilever's on the call. On the Global Water Security and Sanitation Partnership, GWSP, we're using this as an opportunity to provide technical assistance on the ground and to develop knowledge platforms across the countries. What I really want to urge, though, is the importance of sector ministers and governments to take the lead and be out in front. We are here to be behind you, to support you. We want to be able to do it in a very effective and coordinated manner. And so we want your guidance from you. How can we work with other partners and help you prepare costed out and at-scale programs that then can be submitted to the ministers of finance for financing? And how can we accompany you in their implementation? Again, I just want to thank you all for having us here and really look forward to continuing this engagement. Thank you, UNICEF. Thank you, SWA. And I look forward to hearing the rest of the conversation.
Thank you so much, Jennifer, for the kind words and for reminding us that in another world, the World Bank used to organize spring meetings, and that we were all supposed to meet there next week. But maybe we hope to get back to that, to some part of that old world soon. It's now my great pleasure to hand over the floor to Sergio Campos, who is the chief of the Water and Sanitation Division at the InterAmerican Development Bank. I'll ask you, and you know that I will ask you the same question I asked Jennifer. So in order for us to save time, because I see that we are running late, I will give you immediately the floor and ask you to please stick to the time that we gave you. Thank you so much, Sergio.
Good morning, good afternoon, good evening to all. Catarina, thank you very much for organizing this webinar. It's a pleasure for the bank to be part of it. What the Latin American, the Caribbean experiences have been. Just to give you a context, 4 things that have happened in the region in regards to the coronavirus outbreak. First, within the sector, there's conscious that prevention starts with hygiene, preliminary hand washing, but that the social distance guidelines and hand washing cannot be taken for granted, especially in vulnerable populations. Throughout the region, water service provision has been declared as an essential service that is exempt to quarantine. In most places in Latin America, you cannot operate a plant remotely. And then there's a understanding that the knowledge that the economic crisis will hinder the public utilities capacity to provide adequate services, which is crucial for at this moment. The bank has developed a multi-sectoral strategy to address the crisis, in which water is cross-cutting in all four aspects. One of them is geared towards health response. The second one is addressing the needs of safety net for vulnerable population. The third is strengthening the economic productivity and employment. And the fourth is fiscal stimulus packages to ameliorate the economic crisis. The bank has made available to all countries $12 billion, not only for the water sector, but the water sector can take an important part of that. We've already put at the disposal to our countries $4 billion worth of non-committed resources from our existing portfolio, that is water and sanitation. And we're giving the countries the ability to restructure the existing loans and shift them towards water and sanitation, the response. Along these lines, the bank in the water and sanitation sector, the division has developed three main components through which we consider we should support the sector. The first one is, as mentioned, many utilities will see their revenues drop during this period, as mentioned by Vice Minister from Peru. Therefore, we will be providing financing for operational costs, which includes chemicals, energy, rehabilitation equipment, salaries of key personnel. The second component will be the development of emergency plans by providing financings for equipment, systems, disinfection facilities, hand washing sites, that can help communities financing water storages, as well as mass education programs, contingency plans, and systems for remote operation of the networks. And third, access to water and sanitation for vulnerable communities. This would be costs associated to provide the service, to operate and maintain the sanitation systems, particularly in poor neighborhoods, vulnerable communities, through kiosk provisional networks, portable plants, interconnections, and waste collection. In addition to increasing the ability of funds, we've designed new instruments to streamline and support the countries in this crisis. We've streamlined our fiduciary processes and timeframes for approving and preparing operations. And the IDB is also looking in the post-emergency, and we're working in identifying each country's needs in able to address what is going to come first. How can you access these resources? For the ministers in the region, the ministers can gain access to these resources, specifically for WASH projects, by communicating to the IDB headquarters in Latin America. We have offices in every single country in Latin America to make sure that these funds reach their communities as early as possible to the emergency response. And in regards as to what the sector ministers can reach out to their counterparts from the economic and finance, I think that, as mentioned before, social distancing and hand washings in illegal settlements, favelas, low-income neighborhoods cannot be taken for granted. We need to make sure that the most vulnerable have at least access to drinkable water. In Latin America alone, 34 million people do not have access to safe water. That's the MDG indicators, 34 million. And according to the SDG indicator, more than 200 million people don't have access to drinkable water. That's 1/3 of the Latin American population. And that's in water. In sanitation, it's more than 2/3 that don't have access to adequate slash management. Hand washing and hygiene are at the core of the prevention the prevention effort. That's what should be stressed to the finance ministers. The water sector is an essential service exempt of quarantine. I mean, you cannot tell the workers on water utilities not to go to work. And in that sense, the health and the safety net of those workers is essential. There's a high probability that most public utilities, which are already financially weak, will be cash constrained to provide adequate service. Therefore, the most important thing is to ensure that they have sufficient flows to provide an adequate service provision. No? So that's it.
Thank you, Sergio. It was very intense, but you shared also with us lots of very interesting and precious information, and some of the topics that you tackled, and some of the issues that the bank is addressing are very interesting. Very interestingly, are forming part of some of the questions that the audience is already asking regarding the support to utilities, for example, that you mentioned. So let me now turn to Mr. Oswald Chanda, who is the Manager for Water Security and Sanitation Division at the African Development Bank. Oswald, could you please tell us what your bank is doing to support WASH during this time, and what are the key issues our sector leaders should be bringing to the attention of finance ministers?
Catarina, thank you very much for inviting me and giving me this opportunity indeed to share what the African Development Bank is doing in response to the COVID-19 pandemic. I think just before I give you a synopsis of what the bank is doing, I want us all to imagine a scenario of trying to bring home what COVID-19 implies in many parts of Africa and cities. Can you imagine, maybe those of you that have been to Kibera or Alexandria in South Africa, there is a lockdown, and people are expected to remain in their homes. And in these homes, they have no access to they have no toilets, to get water. It's a major problem. And they're in a lockdown. Many of them use flying toilets, which we include in the open defecation. And all these people, are brought and kept in one area and said, you can't move out, you have to stay there. And the situation and the scenario there is quite grave. We might be at the risk of even another epidemic resulting from lack of proper waste management and availability of water. I just wanted us to come to terms with some of the implications of the impact of COVID-19 pandemic. Now, what is the African Development Bank doing in responding to COVID-19 pandemic? Realizing the impact, I think it's been quite elaborated in terms of the loss of revenue, in terms of the impact on the people. But in particular, in regards to WASH, the African Development Bank has raised $3 billion US dollars through a social bond that is being made available to African governments. Now, these resources by the African governments can be accessed within 5 days from the day of request, because this is an emergency. And so these resources are being made available, and these resources are directly injected in the government system. So the government uses its payment system, its procurement systems, so that there are no delays in terms of implementation, so that we can minimize the impact of COVID-19 pandemic. And we believe that this is going to help to cushion the shocks and the impact of COVID-19. But another area, now the approach is holistic, I think, as has been indicated by colleagues. It's addressing the issue of loss of revenue. It's addressing the issue of making water available in the immediate emergencies. It's categorized into emergency, short-term, and a little bit of medium-term solutions. So we have that initial approach. And the second one is to restructure some of the existing loans. Up to 50% of uncommitted resources can be restructured, be given directly to the governments through what we call policy-based operations. So these resources will be available within the government systems. They will need not come back to the African development for any request for no objections or authorization. They just go ahead and implement within the programs that have been already outlined. Now, The other element is we are working in partnership with quite a number of other partners to mobilize additional resources, I think, as was indicated by the minister from the secretary from UK. We're working with the institutions like DFID, we're working with Norway, we're working with several other institutions to mobilize additional resources that can be injected directly into some of the countries that have been severely affected, so that we can address the water and sanitation situation. On the ground, all our water and sanitation experts have engaged with all the other partners and the government to try and develop activities to respond to this challenge, and that includes mobilization of resources. I think in terms of the preparedness of the government, we know very well, and we have been supporting this, that a number of governments have already set up teams, and those teams are multi-sectoral, there are donors involved, there are Ministry of Health, Ministry of Water and Environment, they are all involved in coming up with the priorities of investments, actions to try and resolve the issues. Now, lastly, what we are saying is, I think as has been indicated, the Ministry of Water must engage with the Ministry of Finance, with the Ministry of Health, and I know this is already happening. So I think in terms of preparedness, the ministries are ready and they have the plans. What is needed is to just ensure that these proposals that are coming through include WASH activities. Thank you very much.
Thank you so much. Thank you so much, Oswald, for your words. And it's now my pleasure to give the floor to the Chief Executive of Unilever, Alan Jope. Are you here with us? Oh, good. Oh, just saw you. Good. So thank you so much for being with us. I read in The Economist that you are running Unilever from your study in Edinburgh. Is that so? Very good. So it's a pleasure to give you the floor. Ellen, I'm sorry to interrupt you. Can you choose English? Because otherwise we cannot interpret what you are saying into French and Spanish. So at the bottom of your screen.
Yeah, how's that? I've tried to switch to English now.
Perfect. For me, it's the same. Yes, it's good. They are telling me it's good. Please go on. Sorry for the interruption.
I'm very impressed with your language skills, by the way. Anyway, so we are giving 100 million euros of product away, soap, hand hygiene products, basic foods, but maybe more significantly, we're in a 100 million euro partnership with the UK Department for International Development that Wendy mentioned earlier. We'll be working with trusted partners like UNICEF and the London School of Hygiene and Tropical Medicine. We've identified about 20 countries around the world where we want to put in place awareness programs, make soap available, giving people access, but maybe most importantly, work on behavior change programs. So on the assumption you were able to hear my opening remarks, all I'll say is we need to move at pace. We're still not moving fast enough. And a huge thanks to the Department for International Development in the UK for their partnership. That's it.
Thank you so much. That was good, and it was clear. And you called for action on all of us, and you showed your lack of satisfaction at the pace of our progress, which is clearly not enough to achieve the SDGs. But thank you so much for doing your bit and for making sure that we all do our respective bits. We were supposed to have a Q&A session. We are running very late, 27 minutes late, I'm told. So what I will do is that I will give the floor to the Honorable Joseph Mwanamvenka, who is the Minister of Finance and Economic Planning of Malawi, who joined us on this webinar. And sir, it is a great honor to have you with us, I'm sorry, and a pleasure to give you the floor. Please try to be brief, as I said, we are running a bit out of time. Thank you so much. Are you there, sir?
Thank you very much, Catarina. Can you hear me?
Yes, we can.
Can you hear me?
Yes, very well.
Okay, thank you very much. First of all,
thank you.
Let me thank you for giving Malawi the opportunity to contribute to the discussion, and also to give you a brief on what we are doing as Malawi government in the intervention in terms of water and sanitation. Let me start by saying that when we heard about the coronavirus starting from China, immediately the government of Malawi, through our president, Professor Peter Mutharika, immediately he formed a cabinet committee on the economy, a cabinet committee on coronavirus or COVID-19, of which the Minister of Finance is a member, and it is chaired by the Minister of Health. Minister of Health is chairing that cabinet committee on COVID-19. Immediately after forming that committee, the Malawi government, through that committee, prepared a response plan. And this plan was developed through the cluster system approach led by the Minister of Disaster Management Affairs and Public Events and the Minister of Health. Water, sanitation, and hygiene is one of the 10 operational clusters under this plan, and the Minister of Irrigation and Water Development leads in the WASH cluster and is co-chaired by the UNICEF in Malawi, the country office. The overall objective of the WASH cluster program is to contribute to the reduction of morbidity and mortality caused by coronavirus through providing timely and appropriate preventive and response WASH services in districts that are affected by and are at risk of corona outbreak. Specifically, this plan is there to provide safe and water supply in adequate quantities to affected population in emergency treatment units and other transit centers. It also provides a gender responsive sanitation and hygiene facilities in emergency treatments. We're also promoting hand washing with soap in collaboration with the C4D Films Department. And also we are ensuring that there's a coordinated WASH response to the coronavirus outbreak with other service providers at national, district, and sub-district levels. There are so many objectives that we under this particular plan, but let me now move to what we have done so far. Under the 10 clusters that we have, because we have 10 clusters, one is to do with coordination, communication, health, and WASH is one of the clusters. The total budget for the WASH cluster is $16 million. So far, from donors, we have received only almost $570,000. But the Malawi government, as we speak now, we have contributed in terms of Malawi kwacha, about 10 billion Malawi kwacha, which is approximately about 14 million US dollars. That's the contribution from the Malawi government. Our challenge as we speak now is the gap that is there from our budget, and also we have opened up an account where we are asking the private sector and the donor community in order to contribute to that fund. And I'm also pleased that the World Bank, the IMF, they're also giving us some support. The World Bank has already, as we speak now, they have given us $37 million US dollars in order for us to fight the coronavirus pandemic. So in a nutshell, that's what we have done. And also, we have made a number of initiatives. One, we are encouraging the population and also in all public sector institutions, even the private sector institutions, that they need to have facilities where they are able to provide water so that their people are able to wash their hands, and also we have also provided sanitizers to almost all public sector institutions. So unless maybe you have a question, briefly, that's what we have done. But there's a lot. As you're aware that now we have about 8 cases in Malawi. And obviously this plan is a rolling plan. We are continuously updating that plan to ensure that we're able to combat or to fight this pandemic.
Thank you so much, Your Excellency. And thank you so much for the honor of joining us on this webinar. And we think that it is excellent to have also ministers of finance joining this discussion about COVID, WASH, and finance. So as I said, I will skip the question and answer session right now, and I will do it just at the end. But just so everybody knows, there are 3 recurring questions that we are receiving from our audience. Number 1 is, how are governments helping water utilities, since water has been made free in many countries? So how are the utilities getting support so that they can survive and in the long term? Some of the speakers have mentioned it, namely Sergio, who is smiling. Number 2, how are WASH ministries coordinating with health ministries? And number 3, how can we include specific groups like women and persons with disabilities in the response that we are providing? I'll leave these questions here, and then we'll get back to them a little bit later on. And it's now my great honor and pleasure to give the floor to Minister Cecilia Dapa of Ghana, who is responsible for sanitation and water resources. Minister Dapa, I don't see you here on the screen, but I'm sure that you are. Oh, now I see you. Sorry, I just had to click a button. All is good now. It's a pleasure to see you. COVID-19 will impact household income and livelihoods, as we all know. What will your country do to ensure affordability of water and sanitation services? And what should the sector be doing to ensure that systems and services remain viable after COVID-19? And I ask you, dear Cecilia, to keep your intervention to less than 5 minutes, please. Thank you.
Thank you very much, Catarina. Good to see you and hear your voice again. And bravo to SWA for organizing this. I am very glad to join you in discussing what Ghana is doing in terms of WASH reaction to prevent the spread of the coronavirus, COVID-19 pandemic. I also share with you plans that have been put in place to ensure access to WASH for all, including informal settlements and remote rural areas, as well as how we are planning to finance it and ensure long-term financial sustainability of service provision. Permit me also to extend the warm greetings of His Excellency the President, Nana Addo Dankwa Akufo-Addo, the President of Ghana, and we appreciate very much his leadership in this time of crisis, and it's made all the difference. The major thrust of the WASH intervention was announced by the President on Sunday, 5th April 2020, that the government will absorb all the bills from water for all Ghanaians for 3 months, i.e. April, May, and June. And this runs into a figure of approximately $40 million for the period. And all our water agencies for both rural, peri-urban, and urban are to produce the water and serve the water free to all Ghanaians, especially to our hospitals and health centers. And even those who owe arrears on their water bills, the arrears have been put on hold for them to be able to enjoy the services. We also know the importance of water, how water is central to most SDGs, and most importantly, at this particular time, how water is so important to personal hygiene. We want to fully roll out and continue to roll out the WHO protocols, especially the hand washing and the running water with soap. And we encourage all Ghanaians to do that. It has served as well as the social distancing. And government has also commanded all water tanker services, both public and private, to supply water to vulnerable areas and communities to ensure that the minimum water requirement for each household is met within this period. And availability of water will facilitate, as I said, personal hygiene, especially the hand washing and the running water with soap. All Ghanaians, especially in the lockdown areas, have been provided with hand washing facilities, including what we know here as Veronica buckets. These are containers that have been fitted with pump taps to turn on the water for the hand washing to take place. We have these in markets, lorry parks, and public organizations and institutions. We also have sanitizers that have been fixed all around public places, in offices, in homes, to make sure that the personal hygiene aspects of combating the coronavirus is fully implemented. Also, we have individuals who have installed these in their homes. We have legislators who are taking this up with their various constituencies to help them acquire such hand washing facilities. We also have the Community Water and Sanitation Agency under the ministry, which already has the mandate to teach and educate people on proper hand washing procedures. They are going to continue even after the COVID-19 problem goes away. We also have been doing a lot within the communities vis-a-vis our environment. We declared a 3-day special massive cleaning and cleansing exercise of all our metropolitan areas and our districts, and especially in the 2 lockdown regions. All our markets have been fumigated, and all public places have also been fumigated in all our 16 regions. Also, we are going to provide more litter bins so that we keep our environment and keep our health. On the financing and to ensure long-term financial sustainability of this service, we all know that this pandemic was not expected. So it's thrown all budgets of governments overboard. We are therefore working with the finance ministry, and we've submitted our budgets to pay for the water, both rural and urban, and also for sanitation works. We will continue with our agenda to provide water for all. We'll continue with our hand washing, education, and sensitization. We'll continue to continue with the project for the eradication of open defecation by building more household toilets, because our government has to put measures in place to secure funding to do this, all in the effort to stem this pandemic. One key approach also is the collaboration of stakeholders to leverage resources for the implementation of the plan. led by the Minister for Finance. 600 million stimulus package has been announced by government and provided. It's going to Parliament for businesses. We also have other funding to take care of especially our programs in the wash sector. And I'm confident that the states and government of Ghana would not relent in its efforts to mitigate the spread of the virus. We will continue to adopt the necessary measures and implement to put an end to the spread of the COVID-19 disease. The vulnerable in our society stay at the heart of all this. And the position of government is rooted in the understanding and conviction of the President, His Excellency Nana Addo Dankwa Akufo-Addo. That's, and I quote him, "We know what to do to bring back our economy to life. What we do not know how to do is to bring people back to life." So it's all about people. And the whole nation has been mobilized behind government. In fact, as I speak, vulnerable people within the society are being fed with 400,000 packages of food each day. So this pandemic goes away. I thank you, and I hope to answer any question that might come up. Catarina, thank you for the opportunity, and God
Thank
bless.
you so much. Thank you so much. Thank you so much, Minister Dapa, for your intervention. I now have here a little bit of attention because, okay, I will stick to the order that we foresaw and give the floor to Vice Minister Acero.
I apologize for doing this, but Deputy Secretary Luis Acero has got a meeting right now with the minister. That's why he needs to leave. So for that reason, I would like to pass the floor to His Excellency, the Secretary of the Maldives. I apologize for skipping your turn and for changing things over. But, well, Mr. Luis Acero has promised us to be very brief. Such an honor to have you with us, and you know topics already that we're addressing. So I would like to know and learn more about what type of actions you're taking to ensure the continuity of water and sanitation services, and also the access to these services after these pandemics. Of course, Catarina, I would like to send my greetings to everyone all over the world. It's such an honor to be here with you. As you know, well, I find this type of sessions very fruitful, and these are very good to learn more from all of the initiatives and other errors made by other persons, because we can all learn a lot in this case of emergency. What I would like to share is that us in the government of Colombia, we have about 15, 16 actions specific to the WASH topic that are specifically to assist families, and 3 more particularly that are assisting companies in terms of enabling them to continue sustainable. So very briefly, in Colombia, those families that are not able to suspend their services, or who are not able to make these payments, are somehow just disconnected from the services. We know that in certain countries in the world, it is prohibited to do that by law, but in Colombia, if you do not pay your water bill, then you would stop getting the service. Number 2, in Colombia, we have a stratification system. That means that we divide our sectors in levels 1, 2, 3. Those are low-income families. And then we have 4, 5, and 6. Those are higher income families. So what we do is that for those lower sectors or low-income sectors, what we do is that we provide some sort of assistance, financial aid to these families to just pay for their services, and that's the type of actions that we have taken to continue ensuring the continuity of this water service. Another situation is that we already started putting all of these actions in place a couple of weeks ago, perhaps 3 weeks ago. So these are the type of actions that we will continue to put in place as the situation progresses and moves forward in our country. So we immediately requested and demanded the reconnection, or let's say if they had their services seized, then we ordered water companies to reconnect them for them to get this water supply. That was an emergency decree that we enacted. And that's how we have been able to reach about 250 families. They have been reconnected after this order was enacted. We worked jointly with all water companies all over the country for us to be able to do so. And during the first 15 days, we were able to reach 200,000 families that had this service reconnected or resumed. So this week, we are going to reach 250,000 families all over the country. So that means that over 1 million persons are now receiving this water supply after they had seized it, or they had it seized 3 weeks ago. And that's how we are now being able to reconnect them all. And usually this costs from $5 to $20 American for them to get their bill paid, but they were not recharged or charged for them to get this reconnection. And also to help people with their expenses, we froze any rate increase that would have been expected for this specific quarter of the year. That is not going to happen anymore. No rates are going to show any sort of increase because we somehow enacted in order to freeze these rates. And the third and last action, that is the most important one, is that for all levels, financial levels, like I mentioned, income levels, those low-income families consist of about 9 million households, and those low-income families that deem that they are not going to be able to settle their debts, they're going to be having this facility of just somehow delaying the payment of these services for 36 months after this crisis is over. That is going to be allowed and granted at a 0% rate. We're not allowing any other type of interest rate. And why are we just granting this 36-month period? Well, the reason behind this is that the main rationale for us to be able to make sure that families are going to be able to pay and settle their debts, and well, we're not going to have an increase of over 10% of their bills. So if our expectation is that the emergency lasts, let's say 3 months, then we're going to be able to pay for these bills for 3 months. And that is going to allow us to increase 8% after this crisis. Let's say if they pay $10 a month on their bill, they don't have to pay over $11 per month once this crisis is over. That's on the family side. Now, on the company or business side, we also have other set of initiatives. The main ones are, well, the first one is that we also ceased to charge importing fees specifically for us to be able to enable water to be drinkable. We had about 3% increase before that, and now as of this week, we would no longer charge this type of tariffs and rates on top of this drinking water services, specifically for public and private sectors. We also included this type of tariffs and rates on piping, specifically for water supply. So right now, we're not going to be charging that. That is just to enable the continuity of these businesses so that businesses continue to invest during this crisis. Second action is that for us to be able to just cover all of our portfolios with our families. As we have already mentioned, we're going to give this 36-month credit. So we're going to give this, let's say, if a family gets a bill and the family determines that they're not able to settle that bill, then the company is going to communicate to the government and they're going to make use of a development bank, in this case, the Development Bank of Colombia. The bank is, well, actually, the company is going to report this to the government. The company is going to report that certain bills were not settled, and then this development bank is going to just enable or somehow open this 36-month credits for the company to be able to manage its user portfolio so as to prevent any sort of issues in the standard operations of that company, so that we can enable business continuity and service continuity. And we also understand that state decisions and resolutions could have a negative impact on this, such as a family not paying. Let's say if a family has the resources to settle their debts, they may say, no, I don't want to pay because you're just granting this type of facility. So what we're going to be doing is that for those families who are able to settle their debts, we're just going to just offer certain benefits and discounts so that they can continue paying, because we need to ensure that the company remains profitable. So since we have bank representatives right here with us, I just wanted to let you know that we are just really enabling this type of credit lines for us to be able to enable all of this process. Well, you have the answer already. I mean, that's as better as it can get, right? So that's correct, Catarina. So I'm open for any discussion, and thank you again for having me here. Thank you so much, Deputy Minister. It's such an honor to listen to what you have to say, to learn more about the actions taken by your country. And I know that you have already discussed certain actions with us in the previous webinar that we had. So congratulations and thank you so much.
I will now move to English, and it is my great pleasure to hand over the floor to the Minister from the Maldives, Her Excellency Dr. Hussein Rashid Hassan, who is the Minister of Environment. Madam, I'm so sorry that it is getting so late for you, and thank you so much for staying with us. Your country is definitely facing multiple challenges, including the present dangers of climate change. Could you focus on the impact of COVID today, including, the focus on the impact of COVID today, and how you are supporting households to afford wash services during this time? You have the floor, sir.
Okay. First of all, thank you very much for Catarina for inviting us. And we have had 19 confirmed COVID-19 cases, and so far we have 13 people recovered, and currently we have only 6 active cases, and there is no deaths. And delivering water and hygiene services to our people is a very important priority of the government. And usually during the dry season, still we have to deliver water to the islands. As you may know, like Maldives is a geographically fragmented country where islands are actually separate from each other. So it's quite normal during the hot season that we have to deliver water. So for this year, we have delivered water to a number of islands too. The government will ensure during this emergency too that nobody has lack of water. All the islands will be provided with sufficient potable water for drinking as well as for other purposes. And for this particular COVID-19 emergency, the government has allocated 2.6 billion Maldivian rupiah, of which 300 million is for water and sanitation. We have reduced the electricity by 40%, and 30% on water. It's a subsidy given to the people. So so far we have no real cases where people have insufficient water or sewerage services are provided has been in the country. And actually, it's one of the government's main pledges to provide safe drinking water and also piped sewerage systems during our term in office. So in the next 3 to 4 years, we will have universal coverage of piped water and sewerage systems in the country. So I think we are dealing with this situation quite sufficiently, and the government of Maldives, led by the President Ibrahim Mohamed Solih, is taking necessary steps, and we've been able to control the spread of this disease in the country by actually implementing social distancing and other measures that are necessary. So right now, we're not receiving tourists to our country. We are not flying to other countries either. And we have restrictions on people moving from tourist resorts to inhabited islands too. So therefore, we are dealing with this situation quite well. And with regard to wash, I think hygiene we take is very seriously, and we're providing all necessary hygiene and water services to everyone. We will ensure that everyone will have water and sanitation services during this COVID-19 outbreak. I think these are the things I really want to tell. If there's questions, I will be able to answer. But before I go, I really like to thank our development partners, the World Bank, Asian Development Bank, and others, WHO and UNICEF and others, who has been actively participating and providing their support during this important time. Thank you.
Thank you so much, Your Excellency, and thank you for the mistake I made while I was introducing you, because I brought you forward and I got confused. So thank you so much for your intervention, and thank you so much. We know that it's very late for you. Thank you for staying with us and for sharing with us what you are doing, and please stay safe, and thank you. As I said, well, then let's now go back to our agenda.
This is my great pleasure and honor to give the floor now to Mrs. the Minister for Water and Sanitation and Hygiene from Madagascar, Mrs. Rakotovelo Nansoa. Many thanks for joining us, Madam, and I also have for you the same question that I've asked your other colleagues, which is the affordability. How can we guarantee affordability of services, and also how can we guarantee the sustainability of supply systems in water for the population? Please, Madam, if I may ask you to limit your intervention to 5 minutes. Many thanks. Hello, everybody. And many thanks to SWA. Yeah, there is some echo. Yes, yes. There is still some echo. I'm sorry. Hello, everybody. Yes. It's a pleasure. Please go ahead. Well, in fact, for Madagascar, I will be quite brief for the 5 minutes that you have allocated us. The Madagascar population is in its majority living and deriving a livelihood from small scale agriculture. So at the moment they cannot sell their products, and therefore that leads to lack of revenue regarding the payments for the water and sanitation services. And we had a decision since the dates of the state of emergency that was declared in Madagascar, which was on the 21st of March 2020. And some cities are now in a lockdown, and a number of measures were taken by the government in order not to have public gatherings at the weekly markets, and at the moment these are limited. Going back to the affordability question, we are looking at the situation for our clients who cannot pay their bills for the water services. The government has granted a payment facility for the bills towards these water services, which means that if you do not pay right now, in 2 months, there will be a scale of payments being put forward. But at the moment, different private actors and the state company that provide the different water services have a difficulty in terms of their cash flow, and the state is trying to find a solution in order to provide some subsidies and for these services in the cases where households cannot pay their bills. It's similar to the case in Colombia, where we are trying to also have maybe some tokens available for the vulnerable households in order for them to be able to keep receiving some safe water, or for them to be able to go to some water kiosks in order to get some water, because most of these vulnerable people cannot have access to water within their own households. And therefore, there is an emergency social plan being put together right now. We have started working on this through the food elements, but now we're looking on the multi-sectors, and that includes the water and sanitation services. As for the second question, what should the sector do in order to guarantee that the water systems and services could still be viable after COVID-19? We are looking at how we could put together a possibility to provide a subsidy from the government, that would be from the government via the various partners that will provide a subsidy for the purchase of the services instead of the clients, in order to be able to support the operational costs for these state companies for a period going from 2 to 4 months, in order to guarantee the viability of these services. Also, in order to guarantee our main slogan right now, which is to wash your hands with soap, with the setting up and building of different water points for schools and for many different public spaces that are widely attended by different people, because we have set up some autonomous washing points to wash your hands, but this yet necessitates for some water to reach these points, these facilities to wash your hands. Aside from this, we have also prepared a great awareness-raising campaign to wash your hands with soap throughout the country, and this is planned to be deployed for 6 months with an estimated cost of $5 million, which at the moment is in search of fundings from the partners, but also with the support from the government. So we feel that our reply with all these activities, with having a discussion with Madagascar Cluster Wash, we expect to have a reply that is around $5 million, which $105 million, which includes, in fact, everything that has to do with coordination, the preparation and implementation of looking after the COVID-19 cases, but also all the elements linked to awareness raising, purchase prevention, and also this subvention campaign at the water services level, which we estimate would represent about $45 million on a national level in terms of cost. So this is what we are planning to use as intervention measures in Madagascar, but yet still taking into account the fact that we are trying to get some international funding in order to support the country to have these actions. And we also heard earlier on that there are a number of funds that will be mobilized, and therefore we will approach these different entities in order to get more information. Many thanks to you all. Many thanks, Your Excellency. Many thanks, Madam Rakoto Velomana, also for your participation. This was the main idea behind this webinar, for you all to be in contact with each other and to also learn from one another about the funds available, the initiatives being taken by the donors, by the international financial institutions, and I am absolutely delighted that you managed to take part. Many thanks, Madam. Many thanks.
It's now my pleasure to move to and give the floor to Ambassador Whitfield, with whom I have spoken earlier this week already, who is the Chief Executive Officer of the Liberia WASH Commission. And he's directly accountable to the President of Liberia. Ambassador Whitfield is also the WASH Pillar lead in the COVID-19 response in his country. What is Liberia doing to ensure affordability of services during this time? And with insights from what happened and what you have done during the Ebola response, what should governments be doing to ensure that systems and services remain viable after COVID? Can you speak up a little bit? Bobby, can you speak up a little bit? I think you are not choosing English. Can you click on the English flag or on the US flag at the bottom of your screen, please?
Okay,
so that,
English?
now it's perfect. Perfect.
Thank you.
Please go ahead.
Thank you. Good afternoon, Catarina. Good afternoon to all the honorable ministers and CEOs. Good afternoon to Honorable Kevin Roth, former Prime Minister of Australia, somebody who I follow very, very, often. He's like a mentor. Look, the COVID experience here in Liberia is quite challenging, but thank God we've got a very far-sighted, visionary president, His Excellency President George Manawia, who himself has been leading the challenge from day one. In fact, he put together what we call the SPACO. The SPACO is the Special Presidential Advisory Committee on COVID-19, and he chairs the SPACO. Right under the SPACO, you got the Executive Committee on COVID-19, and then you have got the technical side of the response, which is led by the Incident Management System. And the Incident Management System is chaired by both the National Public Health Institute of Liberia and that of the Ministry of Health. And under the Incident Management System, we've got the various pillars. So you got several pillars: case management, contact tracing, you got WASH. So WASH is a stand-alone pillar, and the WASH pillar is led by the WASH Commission. And that WASH pillar is also, comprising of a number of government agency and ministry, including the Ministry of Public Works, the Ministry of Internal Affairs, the Liberia Water and Sewer Corporation, and all of the different, components of government form part of the WASH pillar. And just speaking again a little bit about, President's involvement, it will please you all to know that the President himself has released one of the best COVID-19 awareness music, and the video has just been released quite recently. But look, it's been very challenging when it comes to getting WASH up on the agenda in this response. I think it has been experienced globally, but also in Liberia, it has been a challenge. I think the focus and the emphasis is on the health, the case management, and sadly, the most important bit when it comes to washing hands is almost, a forgotten, issue, just as WASH is, almost a global forgotten issue. So what I would be looking at in order for government to keep WASH, back on the agenda is exactly what the honorable former Prime Minister said, and the high-level chair of SWA, that is having a substantial support through the ODA, that is Overseas Development Assistance, to countries like Liberia. Because the needs in Liberia is not as compared to the needs in other countries. No, Liberia is a very poor country, struggling economically, and to have that a special, global fund for WASH coming out of COVID-19 will really ensure sustainability and make sure that WASH remain on the global agenda for a very long time. Our vision, which is shared by the sector, is to leave, when COVID-19 should have left and become history, it's not to repeat the same redundant figures that we keep repeating here. 300 billion people, 300 million people have got no access, 3 billion people have got no access to water. All of these figures, we'll keep repeating it. Unless we do something to change it. I don't want to sit here after 1 or 2 years going forward and Liberia still remain as 65% open defecation, practicing open defecation. I don't want to sit here going forward and we see that Liberia still have less than 4% of our people connected to the water grid, that is the pipe-borne water. We got to do something for countries like Liberia to improve the system. I was just talking to the executive director for the Liberia Water and Sewer Corporation. We cannot, give free water because it costs for the services to be run. This is where we really need the international support. Like I said, Liberia is not on the same level with other countries. Back in Australia, you turn off the tap, you will be able to get water. Here, with 4%, less than 4% of our population on the pipe-borne water grid, is just that, you imagine how many more of our people are not having access to, or safe water. If we are telling people to wash their hands, we should be providing water. Very good. We have the Monrovia City Corporation trucking waters into places where they are water stressed, but it is still very important that we focus on building more new wells, more new hand pumps, rehabilitating more broken down hand pumps in the country, getting the equipment necessary to deslug our system in case, we want to prevent future occurrence of diseases spiking up. Any disease spiking up here in a village or in a slum in Liberia will have a ripple effect across the world, just the way COVID spiked up in Wuhan, China, and having this ripple effect on every one of us. So we should incorporate some sense of equity in the global fund for COVID-19, and I want to see coming out of this a global fund for SDG6. Thank you very much, Catarina.
Thank you so much, Ambassador Whitfield. It was really a pleasure to listen to you again. And we are really running out of time. So I will quickly give now the floor to Senator Peter Bembe of Eswatini. And I had the pleasure of speaking with your counterpart at the Ministry of Health last week. And I understand the constraints that COVID is placing on your resources. Could you discuss how your country is dealing with this challenge and especially focusing on affordability of services?
Good afternoon, and good afternoon to all the excellencies on the program. And thank you very much for inviting us to be part of the panel. Eswatini likes to ensure that the citizens of the country continue to have water and sanitation during the COVID-19. The country has located water tanks and washing facilities to most of the areas of the country. And we provide tankered water to these facilities so that people can be able to wash hands, as it has been said over and over again, that the first line of defense is hand washing and properly washing hands with clean water. We have also gone further to defer by 2 months the increase of the tariffs of the water supply company, so that instead of starting by 1st of April, it will now be delayed to June, 1st of June. The government has gone further to establish a resource mobilization team to fundraise for interventions to curb the spread of the coronavirus. There is also, amongst the clusters, the fundraising committee that is working very hard to make sure that funds are raised to look at the needs of the country to fight the COVID-19 pandemic. The country has also deployed teams to speed up rehabilitation of the non-functional water supply schemes to ensure that these schemes deliver water to the communities they are meant to serve. We should be aware that Eswatini has an urban water supply system and a rural water supply system. In the rural sectors, we mostly provide water through boreholes. These are the ones that I say they are being rehabilitated currently. They are being flushed as well. And we are currently just about completing 17 of those, which will improve the situation of hand washing with clean water. The next question was the survival after COVID-19. The country has noted that the community-based approach of managing rural water supply scheme is not very efficient and has launched a pilot to investigate the role that can be placed by the private sector in the management of rural water supply and sanitation facilities. And also, we are also looking or undertaking institutional alignment to strengthen our institutional changes within the development of and management of our potable water supply to ensure efficient service to the population. The country is also implementing large water supply schemes, and these schemes are being funded. One of them is funded by the World Bank. This is a larger scheme that will come from a bigger supply from one of the cities, and it is going to be extending to the rural water, to the rural sector to supply a large population within that area. And we are also looking at another project in the central region, which will be about $60 million US dollars. This is also one of the systems that will be supplying water to a larger population within the rural areas. The country is also strengthening the coordination of water supply and sanitation issues through the WASH Forum, which is responsible for coordinating resources and interventions to ensure total coverage to all the people of the country. Interventions and investments from different sector players are to be guided by the Water Supply Master Plan to be developed in the next year through the support of the World Bank. Government is also strengthening the coordination of the different ministries and departments with the National Disaster Management Authority to ensure the development of linkages and timely address water-related disasters. Government is also testing and will roll out a near real-time system to reporting non-functionality of water and water supply speedily and ensure that the loss of water is reduced. The use of social network for reporting of faults and water losses is also being used in our water utility, and this has helped to also reduce non-revenue water from the water supply networks. This is what I can contribute to the talk. Thank you.
Thank you so much. Thank you so much, Your Excellency, Senator Bembe, for your intervention, and thanks to all the ministers who have made an intervention. It is clear that dealing with COVID-19 starts with hand washing. We all have said it, but it does not end with hand washing. It does not end there. We need more. Systems need to be kept running to ensure services are available. Low-cost options are needed to ensure services are expanded to those who don't have them. All these require money, All these require leadership, your leadership and the leadership of your heads of state, of your heads of government, and also, of course, of your finance ministers. Now we are moving to the part of the discussion where we will have questions and answers. And I also have three people who asked me to make very short 1 minute long interventions because, as you know, we are really running late. So I will give the floor very quickly to Mr. Patrick Moriarty, who is the Chief Executive of IRC WASH and also the Chair of SWA Steering Committee. Patrick, very quickly, we want to hear from you.
Thank you, Catarina, and I hope everyone can see me. So let me start, firstly, Catarina, by commending you and the rest of the Secretariat for pulling this together. I think your response in the face of the crisis on behalf of all of us in the partnership so far has been exemplary, and I know how hard you're all working behind the scenes to make all of this happen. And I also want to thank all of our partners, including all of the ministers who are here today, as you've just said, for demonstrating the exemplary leadership that you are doing. I think that if any of us question the value of sanitation and water for all, this crisis is helping to make it abundantly clear. And looking beyond the current crisis, and I think a lot of people have talked about this already, this is a moment that we have to seize. I'm convinced that we have to bring to the world the message that water, sanitation and hygiene are critical building blocks. They are the first line in strong public health systems. That a wash response is a health response, that a health response starts with a wash response. And as such, it has to be a priority focus for investment going forward. Yet, as we all know, for too many of our countries, we struggle even, and members of SWA, we struggle even to effectively launch that WASH response. And we've heard from ministers how hard they're trying to do that. And that's due to decades of underinvestment and political lack of prioritization of our sector. And as such, I think this is the moment for all of us speaking together to double down on our core message. Yes, of doing emergency response now, but of looking beyond COVID, looking beyond the current crisis to make sure that WASH remains part of the frontline public health intervention that it always should have been. We have really, I think, a once-in-a-generation chance to make this point now, almost exactly 10 years before 2030 and the target of SDG 6. I'm convinced that we can do it. We can do it together. We can do it with our collective voice. We can do it with the leadership, your leadership, Catarina, and our partnership in sanitation and water for all. So I count on all of you, and thank you for being part of this. Thank you.
Thank you so much, Patrick, for your words. So I will ask you, everyone, to please respond quickly as possible. So I had one question for Nigeria, Your Excellency. Since you are still with us, I'll ask you the question. One of the participants asked what Nigeria is doing in order to support people living in rural areas, in rural communities. What are the measures that are being put in place? Another question that is for everyone, and I will only allow two of you to take the floor, I'm sorry for that, is about coordination with other ministries, including the Ministry of Health. And one of the things that we have been hearing is that very often this emergency is treated only as a health emergency, but not also as a WASH emergency. So how are you also working with your counterparts in health in order to make sure that the response is coherent and covers both? But maybe I'll start first with you, Minister Adamu from Nigeria.
Thank you, Catarina. Well, regarding our efforts in rural communities, we already have an established program which we launched in 2016, in response to our failure to meet the Millennium Development Goals and towards meeting the Sustainable Development Goals. What we have done in the last few days is to accelerate the implementation of this program. It's targeted at rural communities, and the idea is we share on a 50-50 basis investment to provide water supply and sanitation facilities to rural communities. That is between the federal government and the states. So that's where we are on that one, and it's been going on. We finished the pilot projects in 2018, 2019, and we are now scaling up, and we have accelerated the procurement process in the last 1 week or so since the pandemic started. Regarding our cooperation with the Ministry of Health, this has been also a well-established relationship between my ministry and the Ministry of Health. We have different forums. We have the National Task Group on Sanitation, which are all members. But beyond that, on WASH in particular, we have an interministerial committee that includes Ministry of Health, Education, Women Affairs, disaster management, and quite a number of and environment that are all part of that. We meet usually twice a year to coordinate our activities because we have cross-cutting activities going on. So that's for us, even before the pandemic, there has been that close relationship, and all we're doing is just making sure that things are working the way they should. Thank you.
Thank you so much, Your Excellency. Does any other of the speakers want also to address the second question about coordination with health, but also with other ministries? If this is not the case, I will move to Ms. Hind and give the floor to Ms. Hind Khatib Othman, who is currently the chair of the Water Supply and... Oh, sí, perdón.
Go ahead, Julio, please. I would like to talk about the multi-sectorial response. Of course, if it's only WASH, we're not going to be able to make it. There must be coordination. The Ministry of Housing is also involved. There are interventions among companies to build and to create modules that will cover up healthcare provision. So the Ministry of Housing is involved with over 400 modules in the different hospitals and health centers nationwide in order to expand our assistance capabilities, to give healthcare to the population. So that's how we're working together with the health sector. And when it comes to education, we are also working with schools, because right now schools up to April 26th are going to remain in quarantine. But we're working on implementation with the Ministry of Education, the Ministry of Housing and Sanitation, so we can implement services at schools throughout the pandemic. Thank you very much. And I'm sorry I wasn't able to hear or to pay attention to what you were saying from the very beginning. Thank you very much.
Thank you. So as I was saying, it's now my great pleasure to now give the floor to Ms. Hind Khatib Othman, who is the chair of the Water Supply and Sanitation Collaborative Council, one of our dear partners. Hind, could you tell us what you are doing at WSSCC to support WASH, including during COVID response, but also beyond? I give you 2 minutes. Thank you.
Thank you. Thank you very much, Catarina. Do you see me?
Yes, I do.
Okay.
And I hear you. Yes, all is good.
Okay, I just want to start by thanking you and thanking SWA for giving us this opportunity to actually talk in this important webinar, but also want to thank you for the organization of such communication platforms during this time. Obviously, we at the Council, the Water Supply and Sanitation Collaborative Council, we are very concerned with the SDG 6.2 and are very concerned with now the pandemic in COVID and what's happening in the majority of our countries, where the response is very weak and where the majority of people cannot even reach to apply the simple measures we're talking about, which is hand washing. So in the Council, obviously, immediately we have been working with the countries that are benefiting from the Global Sanitation Fund to provide flexibility and reprogram our funding in the country, at least 20% of what's available, to ensure that there are messages for protection and prevention from COVID happens as soon as possible. For our long-term planning, obviously, we are very much concerned that this sector that has been chronically underfunded gets the fund and the attention it requires. And as many other speakers have said ahead of me, is that this is sanitation and hygiene is a critical building block, really, for improved health, for improved education, for improved women health and empowerment, for a stronger climate change and resilience. So at the Council right now, we're very busy working on our future strategy, which really calls for this connectivity, for the multisectorality. And for us, our main concern is to make sure that we have a robust and a strong sector beyond COVID. And we are obviously, for us to do that, we have to focus on ensuring, working with partners and countries to ensure that national strategies are developed, they're strong, they look at multisectorality, they are costed plans, and making sure that there is prioritization in country, domestic resources are put at it. And at the same time, we are calling and asking ministers, and I'm very happy that Ambassador Bobby Whitfield has spoken about international also investments in this field and the importance of ensuring that there is predictability for international funds that come forward in support of this sector that has been underfunded for such long time and long years. So what the plans for the Council is really to transform the Council into a sanitation and hygiene fund, whereby it will provide catalytic resources to ensure that we can help countries implement and develop proper national strategies to leave no one behind. And this is the main nature of the fund, which that our steering committee has approved and we're going to launch very soon. Obviously, for us to be able to do it, we need the voices of the countries. We need the voices of the ministers who were with you this afternoon and many more, and thank them for their efforts in containing the pandemic of COVID-19. We need them to also call for international donors and donors in general not to reduce the ODA and to make sure that this building block actually gets the attention it deserves. So thank you very much. I hope I kept it very short to help you at least make up for the time for time.
Thank you so much.
Before I close, I really want to thank all the development partners. Obviously, we are not doing this alone. We're doing this very much in coordination and partnerships with SWA, UNICEF, WHO, and many other, World Bank, and many others. We're very grateful for all those who are with us around the table in helping us develop the strategy and giving us the voice to bring in additional resources. We're also grateful to our donors as well as we are grateful to our countries. Thanks a lot.
Thank you so much, Hind, for sharing the news with us and also for your intervention. To finalize, I would like to give the floor to the minister from Lesotho, who is here with us. We saw you on the screen, but now I don't see you any longer, sir. Okay. Okay. There have been several people asking questions relating to the support to utilities. So it's clearly a concern that some of you have addressed, how governments are supporting, how governments are supporting utilities in order to make sure that they stay resilient and that we don't continue on the services that are being provided, that we don't go to, that there are no slippages, that there are no retrogressions in terms of the realization of the rights to water and sanitation. So since we ran out of time already 35 minutes ago, what I suggest from our side, from SWA's side, is that we are organizing technical webinars. And I think that one of the technical webinars should, and we know that from our private sector constituency, also from the side of the development banks, IADB, but also the World Bank, we know that you are also working on the issue of the sustainability of service providers of utilities and supporting them. So why don't we organize another, but a technical webinar devoted to this more technical issue in order to give guidance, support, and share also good practices on what can be done, how things are being done in order to support utilities. I heard today, I learned already a lot today about this, but I agree that we can go in greater depth. So, to finalize, I would like, thank you, Sergio. I would really like to thank everyone, and we have hundreds and hundreds of people who have joined us today again. So we see the importance, well, that the topic is important and that we are all feeling challenged by this public emergency. There is a lot that we can share. Those countries that have already gone through the process of addressing COVID and those who are just starting. Let me also tell you that the Portuguese Minister of the Environment also was supposed to be here today with us, but he's in a Council of Ministers right now as we speak. He recorded a video with interesting messages that can be of interest to many of you. We could not, for technical reasons, upload it here, but we are sharing it through our social media channels. So to finalize, I'm sorry. Now I lost what I was going to say. I'm very sorry, bear with me. So we have heard that coordinating between ministries has been critical for a successful response. Donors and other actors working together for a coordinated response. We can be more effective if we work together. And I think this is one of the main messages that we have from our side as SWA. We think that we are stronger when we work together. We are stronger when we share experiences, when we criticize each other also. Sometimes we are stronger. When we join hands, governments from different corners of the world, together with development partners, but civil society, academic institutions, and the private sector. And we think this is the first principle of SWA, and we see it is critical in the COVID-19 response. Many countries ensuring that water and hand washing facilities are available. Many countries are doing that and making sure that these services are available not only at homes, but also in markets, healthcare facilities, and other places where people gather. This is very interesting. Also, what we heard is that countries are carefully considering how to both ensure that people have access to water, even when they cannot pay, and protecting the water service providers to ensure that they can continue delivering services. We saw a big interest in working more, in discussing more about that, and we will deliver. World Bank, the African Development Bank, the InterAmerican Development Bank. We heard also from the FID. They are all, and also from Unilever, they are all making funds available for COVID-19 response at speed. If you need to know more, please contact us and we can help you connect if you don't already have the contacts. So thank you so much to all of you for having been with us, for your interest, for your support. And let me also finish by thanking our donors, without whom we would not be able to support you to organize these webinars and other actions that we are undertaking in the context of COVID-19, but also beyond. Thank you so much. Merci beaucoup and muchas gracias. The webinar has ended.